Hi everyone and welcome back to my channel. Tonight's video is one that is very close to my heart and affects a hell of a lot of people, so I really wanted to make this video. And if you're not aware, October is the month of breast cancer awareness. So I wanted to do a little video about that. Now, I want to start off by saying I am absolutely by no means an expert on cancer, whether it be breast cancer or any type of cancer. I have never had cancer before myself, but I did lose my beautiful, lovely mother to breast cancer in 2013. She unfortunately passed away when she was 53. She had lumps on both of her breasts and then it developed in her liver, which there was no cure for. So unfortunately, it took her life. So I basically just want to have a little chat about it, give a little bit of information and yeah, just raise awareness for it. So I wrote some notes down in my book and I've also got my laptop here just for a bit more information, and I am using my ring light. I know I'm not doing makeup so I don't really need to use it, but because I've bought it, this is the second video I've done with my ring light and I wanted to try it out. So if it's a bit in and out with the lighting, I'm sorry, but please bear with me. So as I said, October is Cancer Awareness Month. So Wear It Pink is the campaign that they have for this particular awareness. It's a worldwide annual campaign. It involves thousands of organisations highlighting the importance of breast awareness, education and the research that goes into breast cancer. There are many ways that you can get involved and show support, and if you actually go onto the website, it is called breastcancernow.org, and it will show you all the different ways that you can get involved and raise money. Or you can just go on to Breast Cancer Awareness page yourself and donate whatever you can afford to donate to the charity. Every little does help. So basically, breast cancer just now, it's saying the progress is stalling in the prevention and diagnosis and the treatment of breast cancer. Obviously, breast cancer does affect everybody differently. Your breasts can change with age, different times of the month, i.e. your periods. You know, they can be tender or maybe feel a bit more lumpier than they would normally. Obviously, if you notice anything drastically out of the ordinary, it is so best to go and get checked out. It could be absolutely nothing, but it's so important to not just shove it to the back of your mind and think, oh, there's nothing wrong. That's what my mum did the very first time. I remember she was in the bath and she said to me, oh, Julie, come here, will you check this? Do you think that's a lump or what have you? I checked it for her and it was a solid lump, and I said to her, yes, that's a lump. Now, did she go to the doctor straight away? No, she didn't. She just washed it to the back of her mind. Now, in hindsight, you could be like, had she have been more proactive with that, it could have not necessarily prevented her from having breast cancer because it was obviously there within her, but it could have been dealt with quicker. So please, 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 and I include myself in this, if you notice anything, go and get it checked out. It could be completely nothing. I know it's a scary thing, but go and get it checked out. Okay, and it says here, the most common symptoms women think of with breast cancer is lumps. And most lumps you feel are fine or they're benign, which is non-cancerous. And then they've got this little saying on their website called TLC, which is touch, look, check. TLC, touch, look and check. So basically, touch your breasts, see if you can feel anything untoward. As I say, a lot of times, especially with people with bigger breasts like myself, you can be thinking, oh God, is that the norm? What's going on? You know, so we need to try not to panic, obviously, but if you do find something out of the ordinary, then definitely go check it out. Look in the mirror, look for changes in shape and texture to your breasts. Does it look any different? Is one longer, one larger? We usually have one larger than the other, so that's maybe not necessarily, you know, a bad thing. But if there's anything really predominantly that you notice different, again, just go and see about it. Check and see if there's anything unusual. Do you have a lump there? Are your breasts, are your nipples leaking? Have you got crusting on your breasts? You know, just all these different sorts of things. So here on the website, it's got, I don't know if you can see that, the symptoms. Oh, okay, that helped, didn't it? Hold on a minute till we re-plug you back in. So I'm going to read from my laptop just some of the things. I mean, I'm not trying to speak down to anybody or be like, oh, this is just, I want to just do this for my own sake and to show my support for it all. So basically it's got changes to check for. So obviously the main obvious one is lumps. A lump may not be seen, but it might be felt. Can you feel a lump either in the breast, on the upper chest, or under your armpit where your lymph nodes are? Is there a lumpy area or unusual thickening of the breast tissue that doesn't go away? Is there any unusual pain either in part of your breast or your armpit? Now, obviously, when it comes to your time of the month, you can have a tender breast, sometimes you get arm pain, all that sort of jazz. So if it's round about that time of month, it's not possibly going to be anything that you're going to be worried about. But if it just happens to be that it's not your time of the month, it's worth keeping an eye on. Okay, then it says skin texture. Skin texture, for example, dimpling or puckering. Any change in the size or shape. For example, one breast might become larger or lower than the other. A change in colour, i.e. the breast may look red or inflamed, such as puckering or dimpling of the skin of the breast. The next one it's got is the appearance or direction of the nipple. What about the appearance or direction of the nipple? So, for example, they have put one might become inverted, which is turned in, when it normally points out. Now, this might be TMI for some people, and obviously I'm not going to go and whap my breasts out and show you them because that's just inappropriate. But I have inverted nipples. I have had inverted nipples since all through my life. They haven't suddenly inverted. I have been to the breast clinic and been checked, and I've also spoken to my doctor about it because I myself was like, oh my god, like, would I even be able to breastfeed a child if I had a child, you know, and all these sorts of things. Now, because of my breasts, my nipples have always been inverted. This isn't something that I need to worry about because it's always been like that. What they are referring to here is if suddenly your nipples are predominant nipples and then they suddenly invert, that's possibly something to go and check out. But there are some of us out there, like myself, that unfortunately do not have prominent nipples. We have inverted nipples, and there is nothing wrong with that at all. But if you suddenly see that this has suddenly happened to you, it's maybe worth checking out with your GP. Okay, the next thing they've got is nipple discharge. Any unusual discharge on one or both of the nipples. So obviously, unless you're breastfeeding or just finished breastfeeding or pregnant or what have you, that's another thing that's not common. Sorry, the camera just cut out there. What I was saying is if you find that you've got any discharge on the nipple, it might be worth going and getting checked out if you're not breastfeeding or just had a child or what have you, because that's obviously something that they're saying is that you should check out for. The other thing is a rash or crusting. Any rash or crusting of the nipple or the surrounding area. So again, this is something that possibly you might want to go and get checked out just to be on the safe side. So again, you can go onto their website and you can download the app called the Breast Check, and you can download it for free from Android or iPhone. And yeah, you can even go onto Facebook. They've got a TLC Touch Look Check video, and that will show you exactly how to check your breasts. Now, I am just as guilty as a lot of women out there, and even though I lost my mum to breast cancer, I do not check my breasts often enough or as much as I should do. It doesn't take much to do it. When you're in the shower, when you're getting dried, just have a wee check, see if there's anything. Now, personally for me, I suffer with anxiety, so I try not to think of all these things too much, or it just tips me off the scale. But I think it was last year I went to the breast clinic. I've been twice. Now, they won't let me have mammograms early, even though my mum passed away of cancer. A lot of people in her side of the family have had cancer and passed away from it. The earliest they will let me go for a mammogram is when I'm 40, because they say your breasts are changing and developing all the time. So that's just the way it is, I suppose. I mean, in a sense, it does annoy me, because not only is it people, like loads of women, some women in their teens, some women in their 20s, they get breast cancer. It's not just people in their later life. So I personally think, specifically for someone like myself or anyone else out there who has a lot of cancer within their family, they should be allowed to have these sorts of tests and kept an eye on for that specific reason. I mean, obviously it doesn't mean to say that I'm going to get cancer because my mum had it, but I think it puts me at a bit of a higher risk. So therefore I feel that I should be able to go and get checked on more regularly, but they're not willing to do that. So there you go. The earliest I can go for a mammogram is when I'm 40. Now, I am going to be 34 in December. So, you know, that's just the way it is. Now, a few months ago, or I don't really know particularly what month, but I think it might be the beginning of this year, I went to the breast clinic, and I went because I had checked my breasts. I did have my period, and I thought, oh my God, there's a lump. It was worrying me, and I thought there's no point in me sitting here worrying about it and not doing anything about it, getting myself all het up and panicking. So I decided to take myself to the doctor, and it happened to be a locum doctor that was on, and he asked me about my family history, and he just said, well, I think it would be worth sending you to your local hospital, to the breast clinic, and just getting them to have a check, discuss your mum, your family history, and just maybe keep an eye on you. And I went and I did the tests that they did, the ultrasound and everything is fine. There's nothing there at all. He was saying that basically, 1, because I have larger breasts, 2, because larger breasts can be lumpy. Sorry, camera stopped again. I'm going to wrap this up. It was like a little nodule, and it wasn't anything to be worried about. But since I have gone and done that, I am now more aware and make sure that I do check my breasts at least, I want to say once a month, but I don't do it once a month. But I do try my best when I'm in the shower just to have a wee feel and see and make sure. So please do go on to the websites, look up TLC Breast Check, look up the app on your Android phone or your iPhone, and make sure you check your breasts. Me included, I have to do the same. And if you notice anything, please do go to your GP and get it checked out. It could be absolutely nothing, but it'll put your mind at rest. It'll put your family's mind at rest if you've told them. Speak to someone about it. Message me if you want to. Sometimes it helps to speak to a stranger. Just please know that it doesn't necessarily mean that there is cancer there, but it's best to check it out. So I hope this video wasn't too depressing, and I hope I did it some kind of a justice. As I say, it's something that's very close to my heart because I lost my mum to breast cancer, and it's her remembrance on the 19th of October. It'll be 14 years. And I really wish she was still here, obviously, but I wish now that when I was 16 and she showed me that lump and I felt it for myself, that I was like, come on mum, you have to go to that doctor. But I was 16, I thought nothing of it. Would it have saved her life? I doubt it, but the sooner you take action, the better. So anyway guys, I hope you enjoyed this video. Thank you so much to everyone who supports my channel. Please do keep subscribing. It means a hell of a lot to me, and I will speak to you very soon. Bye bye.